Epithelial sodium channel blockers, or ENaC blockers, are a class of drugs used to treat nephrogenic diabetes insipidus and Little syndrome. As their name suggests, they work by inhibiting epithelial sodium channels of the kidney's collecting ducts, increasing sodium excretion through urine. In this visual mnemonic, we'll give you an easy way to think about the mechanism and uses for ENaC blockers. Ah, what a great day for a cookout. It looks like today's menu includes some yummy, salt-crusted fish. You know that cooking technique where you encase fish in a rind of salt? Well, this crust should help you think of the epithelium, since the crust forms an outer layer or surface around the fish, just like the epithelium forms the outer layer of tissues. The salt here specifically should help you think of sodium channels. Together, the salt crust is our symbol for epithelial sodium channels, or ENaCs. Lastly, the fish must be ready because we're breaking into this salt crust. The broken salt crust should help you remember that we are talking about ENaC blockers, because breaking the salt crust is kind of like stopping it from working, right? ENaC blockers, as their name suggests, are a class of drugs that inhibit sodium channels on the epithelial surfaces of tissues. Specifically, these target the epithelial surface of the distal tubule and cortical collecting duct, inhibiting the reabsorption of sodium from urine. But before we get too far into the nitty-gritty of how these drugs work, let's introduce a few names of the drugs you should know. For that, turn your attention to the trampoline at the cookout. It looks like some of the guests are playing a competitive game of spike ball. You know, that picnic game where you try to bounce a ball on a tiny trampoline? By the way, this trampoline can help you remember triamterene. Get it? Trampoline for triamterene? Triamterene is the first drug name you should remember from the ENaC blockers class. Eek! This huge millipede just crawled up onto the trampoline in the middle of the game. This millipede is our symbol for amiloride, the second ENaC blocker drug you need to remember. Because a millipede sounds like amiloride, right? Now that we've learned the important drug names for the ENaC blockers, let's learn about how these drugs actually work. Ah, I see why the salt crust broke now. The millipede freaked out one of the spike ball players and he accidentally shot the ball way over to the food table. The ball hit the salt-crusted fish, and now the salt crust is falling everywhere. This falling salt reminds me that ENaC blockers increase sodium excretion, since blocking ENaC blocks sodium reabsorption in the kidney. In case you don't remember, epithelial sodium channels, or ENaC channels, are channels located on the apical side of principal cells, in the distal tubules and collecting ducts. These channels are responsible for reabsorbing sodium from the urine filtrate. ENaC blockers block these channels, preventing sodium reabsorption. By doing this, ENaC blockers lead to increased urinary excretion of sodium. The end result is less salt in the body, which you can picture by remembering the falling salt crust here. When the ball ricocheted off the fish, it happened to hit someone. This guy stumbled backwards into another food table, sending some bananas and lemons flying. At the last minute, someone was able to catch the falling fruit. By the way, the banana should remind you of potassium, since bananas are rich in potassium, right? And these acidic lemons should help you think of acidic hydrogen ions or protons. Putting this together, the bananas and lemons that had been caught or prevented from falling should help you remember that ENaC blockers prevent the secretion of potassium and hydrogen ions into the urine filtrate. To be more specific, when ENaC blockers prevent the reabsorption of sodium, the urine's filtrate has a more positive potential due to all the positively charged sodium ions. Because positive charges repel one another, this creates an unfavorable environment for potassium ions within the tubular lumen. As a result, less potassium ions are secreted and lost through urine. For this reason, ENaC blockers are often called potassium-sparing drugs. As for the protons, Recall that a later part of the collecting duct actually contains a hydrogen ion-potassium ion exchange pump. That is, it brings in potassium in exchange for pushing acidic protons out. Since less potassium is in the filtrate due to the mechanism we just talked about, less acidic protons are also excreted. Now that we've covered how ENaC blockers work, let's discuss some clinical uses for these drugs. A water pitcher was also jostled on the table. The man was able to catch it at second to prevent the water from spilling out. It's a good thing that he prioritized catching all the food and drinks that are usable, leaving the salt crust to fall. This caught water pitcher should help you remember that ENaC blockers treat nephrogenic diabetes insipidus, or nephrogenic DI. Since preventing the water from spilling out is like preventing excess urinary fluid loss, right? Nephrogenic DI describes the inability to concentrate urine, caused by impaired ADH signaling in the collecting ducts of kidneys. Chronic lithium use is a common cause of nephrogenic DI, since lithium can downregulate the expression of proteins involved in water reabsorption. ENaC blockers, particularly amiloride, can be used to treat nephrogenic DI, including that caused by lithium. Lithium, an ion similar to sodium, is reabsorbed into the principal cells of the collecting duct through ENaC channels. By blocking these channels, amiloride prevents the reabsorption of lithium and reduces its adverse effects. The lemons and bananas were caught on a glass pot lid that had been used to cook the fish. This lid is our symbol for Little disease. Get it? Lid for Liddle. Little disease describes a genetically inherited kidney disorder, where a gain-of-function mutation in the ENaC channel causes an upregulation of sodium absorption. Because ENaC blockers directly inhibit these channels, they can reduce the excess sodium reabsorption that occurs in these patients, thereby treating little disease. Okay, we're almost done. Before we go, let's take a few moments to learn about some adverse effects of ENaC blockers. Firstly, ENaC blockers can lead to hyperkalemia, or high potassium levels. Recall those caught bananas from earlier? When we said that ENaC blockers are potassium sparing, it's pretty obvious then that retention of potassium might go too far and actually cause hyperkalemia. This is especially true in cases where ENaC blockers are taken alongside other drugs that also can induce hyperkalemia, like ACE inhibitors. Like with potassium, recall that ENaC blockers decrease hydrogen ion excretion in urine. This can go too far, and excess retention of hydrogen ions can cause metabolic acidosis. All right, that's it for ENaC blockers. Let's summarize. ENaC blockers are a class of drugs that include triamterene and amiloride. As their name suggests, ENaC blockers inhibit the epithelial sodium channels located in the distal tubules and principal cells of collecting ducts in the kidneys. By inhibiting sodium reabsorption, ENaC blockers increase sodium excretion into the urine. They also reduce potassium and hydrogen ion secretion, which is why these drugs are sometimes called potassium-sparing drugs. These drugs are often used for the treatment of nephrogenic diabetes insipidus, including that caused by lithium. These drugs can also be used to treat little disease, a syndrome of overactive ENaC channels. The adverse effects of the ENaC blocks are related to their mechanism. In particular, retention of potassium and hydrogen ions can lead to hyperkalemia and metabolic acidosis. Okay, now we're actually done. That fish smells so good. I think I'm gonna go grab a bite. I'll see you in the next video.